6:47, we have news, sports, and traffic coming up at the top of the hour. We'll also give you an update on the weather forecast, but right now we continue to take your calls, so we invite them. You can call us at 228-5562 or 228-5563. But of course, we are continuing. I think we have Tanya and Veronica holding. So good morning.
Hi, good morning.
Hi, is this Tanya?
Yes, it is.
All right, go ahead with your question to Dr. Lord.
Okay, I'm just asking, I'm getting swelling in my left ankle from the time I was 14, and I'm now 30.
Okay.
I have been to probably about 10 or 11 different doctors, and no one can seem to tell me what is the problem. Can you give me some, light on what is going on, please?
The left ankle only?
Left ankle only.
No, you're number 12.
She's number 12 now,
no
so
pressure.
I said, sorry, I can't give you the answer either. I'm not sure. Obviously, it's not anything that from an injury because it's been going on for 18 years, from what, 18 to
14 to 30.
That's 16 years, right, Colin?
Yes, it is.
Yeah, better ask Colin.
Yeah, no, there is some local problem to that leg. I'm sure they would have done various tests, x-rays, and checked the circulation and checked the veins. It could be a venous problem. I really can't give you an answer. You probably need to see an orthopedic surgeon to make number 13 and see if that doctor could help you, or a vascular surgeon.
Well, we hope that will be lucky number 13 for her. Well, we're going to go and take our first traffic update for the line. We'd like to ask our caller who's holding to continue to do so. We have not forgotten you, but we're going to take our first traffic update.
Morning Barbados Traffic Report brought to you by Sani Services Limited. Clean air in your office is our concern.
And it's time to say good morning to Constable 1262, Lizelle Gabriel.
Good morning to you.
How are you?
I am well this morning, and yourself?
I am good. Good to hear you.
Nice to hear you too.
All right.
Okay, this morning it's very rainy, as we all can see, and I want to implore upon motorists as you head out to watch out for the pedestrians, especially at the crossing. We had a call this morning from a concerned pedestrian. He said he was in the middle of the crossing when a vehicle approached and splashed him up with the water. So we're asking that motorists, please, as you approach pedestrian crossings, just to watch out for the pedestrians. And also, to the pedestrians, you too must be careful and only proceed when it's safe to do so. And if there's a pedestrian signal, only cross when the light says to cross. So then, most of our major highways this morning, Highway 1, Black Rock to Spicetown, traffic is moderate. Highway 2, Barbary Hill to Jackson, light to moderate. Highway 4, Mylars Hill to Greens, moderate. Highway 5, Government Hill to Brayton, moderate. Highway 6, Colomar to Newton, light to moderate at this time. Highway 7, Bay Street, Providence, moderate as well. And along the Runnymap Highway, Darcy Scott, around about 2 miles and a quarter, light to moderate at this time. Until my second report, back to you, Colin.
Well, thank you very much, Constable Gabriel. That was our first traffic report of the morning. We'll have 2 more.
Morning Barbados Traffic Report brought to you by Sani Services Limited. Clean air in your office is our concern.
And now we'd like to thank Veronica for exhibiting such stellar patience.
Yay.
Good morning, Veronica.
Good morning.
Good morning.
How is everybody this morning?
Good.
Very well,
Very
thank
good.
you.
Okay, my question is about varicose veins. Are they hereditary? And if not, who is prone to get varicose veins? And can men get varicose veins?
Okay.
Last question. Yes, men can and do get varicose veins. They can be hereditary. Who is prone to get them? Women are more prone to get them than men, but people who are on their feet quite a lot, stand on the feet, tend to have them. Women get them more because of hormonal things as well as pregnancy. Multiple pregnancies, you tend to see varicose veins, maybe because of the pressure of the fetus on the veins of the pelvis causing these things. So men get them, women get them, people who are generally on their feet a lot. Treatment, elevation, stockings, and there's medication that can be used to correct for these things, and of course, if that fails, surgery.
But not just any stockings. Okay.
No, elastic stockings.
Right.
Yeah.
Can they go away? Can you get, or if you catch them soon enough, can you get rid of them?
Yeah, you can deal with them with any of the methods I mentioned before, which can reduce them significantly.
And to be honest, Doc, sometimes we're not, well, I'm not 100% sure what is just being someone who's like perhaps fair-skinned, being quite vascular, where you can see them, they're kind of stand up and green, and actual varicose veins, which is a different kind of condition. What do I look for? Do I look for a raising of the actual skin or a difference in color?
Well, you don't need to have the raising to have varicose veins. That is when they're more distended and so on. But you see these tortuous veins in the legs, just what you described, the greenish in a lighter skinned person, and may cause some discomfort or burning in the legs sometimes.
So the discomfort and the color, what you're looking for to differentiate varicose veins from just perhaps an inflamed area.
And they are usually tortuous.
Which means they're curly?
Curly, yeah.
Okay. We have, is it Angela on the line? Good morning.
Good morning.
Hi, go ahead. You're live on air.
My name is Angela.
Morning, Angela.
Morning.
I've been having these constant pains on my tummy, and it sometimes be it hurts very bad. I would like to know the reason.
Lower abdominal pain. In Jamaica, when we were medical students, used to hear about belly bottom pain. And yeah, that can be caused by a number of things. It could be right in that area is your urinary bladder. So if you have a bladder infection, that can cause problems. But also in the female, as you are, there is the genital organs, the uterus, tubes, and ovaries. So uterine fibroids can cause it, ovarian cysts, or pelvic inflammatory disease, that is infection or inflammation of the tubes, that can also cause it. Also in that area is the rectum and the last part of the intestine, and you can get pain there as well. And then you can get radiated pain from other organs within the abdomen that can radiate to the lower abdominal area. You will have to look and see if there are other symptoms. Like increased urination would make us think about the bladder. If there's heavy periods and painful sexual intercourse, we can think about the uterine tubes or uterus, the tubes, or ovarian cysts. If you have irregular periods, so that if you have other associated symptoms, may help to guide us in one direction or the other. So you need to see your doctor and get it evaluated properly.
All right, let's say good morning to Mary.
Good morning.
Morning, Mary.
Good morning to all of you. Here's my question. Many years ago, I had an emergency surgery for appendicitis, and then I had to have another surgery for something else. And then I had 2 cesareans. And when I had the first cesarean, the doctor said that I had heloids, and they cut me one place all the time. I want to know if I'm having tummy ache now sometimes. I'm wondering, can this be heloids? Can it cause the tummy ache? And what really, he said the heloids is like when you get things growing, when your ears is pierced and the flesh grows out.
Yes.
That is a heloid. And they said they cut me one place because they, all the time, because I was having heloids in there. And I'm wondering, can this be causing my tummy ache nowadays?
Yeah, keloids is what you have usually on the skin, and that usually doesn't cause tummy ache. That may cause burning or itching along the scare. What you're having is intra-abdominal pain, and similar to what you were having with keloids, what we call growing flesh.
Yeah.
Right? You may be having tissues or what's called adhesions inside of the abdomen where because of the multiple surgeries that you had, you were getting tissue joining to one another, like bowels sticking to one another and so on. So you can have something like almost like keloids on the inside or growing adhesions. It almost looks like cobweb. I don't like to tell people so because I think it is something dirty. But it's tissues being joined by other tissues, connective tissue, and that can cause some pain inside there. And that can be treated laparoscopically, where they can look through a small incision through the navel and go in with a tube and just break down these adhesions without major surgery.
We've had a couple of questions regarding the abdomen, Doc. Are there anything generally that we should not ignore in terms of the abdomen? You know, sometimes they say if it's a left side pain, you should rush off because it could be. But are there things that we should generally ignore?
If any persistent abdominal pain, any change in bowel habits, if you're constipated all of a sudden or having difficulty in passing stools, or alternating constipation with diarrhea, if you're having bleeding or the stools become dark or black, those are things that you should monitor, or if you've lost weight or lost appetite associated with it, or the stools become gray or light yellow, that could suggest that there's something that's happening in the abdomen.
All right, we have 2 calls to take in less than 2 minutes, so let's go first to Janelle.
Hi, good morning.
Morning, Janelle.
I just wanted to ask the doctor, okay, I'm an asthmatic, not a bad asthmatic, but recently I started working out and I realized that just down between my chest, I'm getting this very tight burning, and I just wanted to know, like, you know, how much pressure, sometimes even laying down, it feels very uncomfortable, so I just wanted to give me a brief idea of, you know, what may be causing that.
You're probably having exercise-induced asthma, which is asthma or bronchospasm or a constriction brought on by exercise, and that can be easily be treated by using one of your inhalers half an hour to 20 minutes before exercise, 2 puffs, and you'll find that that problem, which occurs typically 6 to 8 minutes after exercise, will cease.
All right, we have Patricia on the line. Good morning. Welcome to the program.
Good morning,
Good morning.
everyone.
Good morning.
Doctor, my question is, and recently I've noticed that I have tingling under the bottom of my feet, both. It started with one, but now there's both. And especially when I get up in the morning and put the foot down, or if I walk and then I sit down and the foot is relaxed.
Yes, tingling or tightness or pain in the bottom of the feet, especially after inactivity, is usually most commonly due to tightening of the fascia or the tissues to the bottom of the feet, which occurs at rest. It's called plantar, meaning the bottom of the feet, fasciitis, which is F-A-C-C-I-I-T-A-S, which is tissues tightening there, which may be to do with the arches of your feet, so you may need to use orthotic devices, that is inserts into the shoe, or wear shoes that are not flattened soles, shoes that are consistent with the arch of your feet to prevent this tightening occurring whenever you rest.
Wow.
All right, thank you very much, Doc. As usual, very informative and to the point.